On this Monday night, another dose of hope. A second potential COVID-19 vaccine shows preliminary promise.
I think we should approach this with cautious optimism.
What we know and don't know about the latest vaccine candidate. Overwhelmed and under pressure.
We can't sustain this number of cases.
Hospital beds are filling up right across Canada. Plus, keeping the coronavirus under control in classrooms. Could Christmas break come early for some schools?
That's our last solution.
And finally allowed on the beach after 38 years.
First time I've ever been on it in my life.
The island that's landmine free and what it took to make it happen.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with what appears to be more promising news about another vaccine being developed to prevent COVID-19, the second in a week to exceed expectations. Moderna says preliminary data shows the vaccine it is testing is 94.5% effective. It requires 2 shots 28 days apart, and it does not need ultra-cold storage, making it easier to distribute. Pfizer's vaccine, which showed 90% effectiveness in early results, also requires 2 doses, but it must be stored at -70 Celsius. Canada has pre-ordered tens of millions of doses from both Moderna and Pfizer. This does not mean that either of those vaccines is approved for use. The clinical trials aren't complete, and there is still much more data to be analyzed. Questions still remain, including how long either vaccine would protect you. But it is promising news as we head into a dark winter. Carolyn Jarvis has our top story tonight.
The moment we learned, I ended up with a grin from ear to ear, incredibly excited. I put myself on mute and yelled that excitement out.
Early results from Moderna's COVID-19 vaccine exceeded even its own expectations at 94.5% effective. A vaccine now in phase 3 of clinical trials, which involves 30,000 people. But while Moderna may be celebrating, experts say we don't know enough just yet.
I think we have to really bring it back down to planet Earth for a second and see exactly what they mean. We don't actually have the data. This is really a press release. So, at the surface, it looks very promising, but I think we should approach this with cautious optimism. The study isn't done. These are not the final results.
Moderna's vaccine, like Pfizer's, is using what's called an mRNA approach. It's a new type of vaccine that's never been approved for use in people. mRNA vaccines take the genetic code from a virus and use it to provoke an immune response. To answer the demand for its vaccine, Moderna has set up 2 manufacturing centers.
One based in Switzerland for satisfying our commitments to Canada, and one obviously in the United States for satisfying the United States. So they do not directly compete, and we wouldn't expect there to be any waiting in line behind Americans.
But first comes approval. Health Canada is already reviewing data from phase 1 and 2 of Moderna's clinical trials. The full data set from phase 3 should be submitted in the coming weeks.
What we're really focusing on currently is to make sure that we analyze the data that come out efficiently. And we really want the Canadian population to know that we are not cutting corners.
If the data supports this vaccine, it will still be months before all Canadians receive it. In the meantime, the health minister cautions we have to remain vigilant.
Despite the fact that there's light at the end of the tunnel, we have dark months ahead of us. And that if we want to protect the lives of the people that we love, if we want to protect our own wellness, that we have to continue with the public health measures.
Carolyn Jarvis, Global News, Toronto.
With case numbers surging, Canada has crossed a grim new milestone. More than 300,000 cases reported since the start of this pandemic. Here's the picture today. In the Atlantic bubble, there were 10 new cases, 8 of them in New Brunswick. There were more than 1,200 new cases reported in Quebec, more than 1,400 in Ontario. Alberta reported 860 new cases today. There were almost 650 reported in BC. And in Manitoba, the worst per capita in Canada, there were nearly 400 new cases and 10 more people died.
We can't sustain this number of cases in our healthcare system. Our hospitals are near capacity. We have over 40 people in ICU with COVID-19 right now. Our healthcare providers are becoming overwhelmed.
Here's the path Canada's hospitals are on. After a big drop in cases in the summer, the number of Canadians ending up in the hospital with COVID-19 is climbing. As of November 7th, there were nearly 1,400 COVID-19 patients in hospital in Canada. That is an increase of 16% from the previous week. In Ontario, there are now so many patients in some hard-hit regions. Hospitals are warning they are nearing capacity. Eric Sorensen reports on the growing strain on the system and a campaign for aggressive new restrictions.
As of now, Trillium Health Partners, 3 hospitals in Toronto and Mississauga, are at 99% capacity. Ontario has seen a spike in COVID-19 cases, and now hospitalizations are on the rise too. From 1 month ago, the number of cases has almost doubled, from over 700 per day on a 7-day average to more than 1,400 cases per day. Hospitalizations stood at 230 per day a month ago, now 459 per day this week. At Etobicoke General, they have 70 COVID patients, but another 33 who are suspected and need separate rooms that are increasingly in short supply.
The 33 suspected cases need to be in 33 separate rooms, which makes it very difficult for us.
As of now, Ontario has expanded its red zone from Toronto down to Hamilton, with restrictions on restaurants and gyms, urging people to stop getting together in groups or going out at all except when necessary.
I'm sorry for a lot of the small businesses, but it's better to have a healthy and safe community than one that the virus just is totally out of control.
One specialist says Ontario should bite the bullet and impose a sweeping lockdown, a COVID-0 approach, because half measures, he says, aren't working.
The problems with color-coded systems is that they encourage you to tolerate low levels of disease, which inevitably get out of hand. So the only way to move forward is to get control of COVID-19.
Ontario's chief medical officer is considering lockdown measures, but what to lock down? Businesses or schools or both? And hard-hit urban centres or the entire province?
What are the consequences of doing that action at this time? Are there severe consequences? Are they minor consequences? But what's the benefits, and to weigh those out and to make sure you move on them?
For the moment, Ontario's aim is to improve the numbers before Christmas so families can get together. But the Premier is also preparing Ontarians for a Christmas without big family gatherings.
We'll always have other celebrations, we'll always have other Christmases, but if the numbers continue to spike, as I said before, I won't hesitate in a heartbeat to lock things down.
The numbers in Ontario are expected to keep rising. The question is, how high will they have to go for Ontario to consider targeted or widespread lockdowns? Eric Sorensen, Global News, Toronto.
Rising numbers in Alberta are straining the system. There were 20 new deaths reported in that province today and more than 860 new cases in 24 hours. The positivity rate is 7% now, and there are so many active cases, contact tracers can't keep up. Alberta doctors have pleaded with Premier Jason Kenney to impose tougher restrictions, but as Heather Yourex-West reports, some Albertans are now taking matters into their own hands.
For weeks, Alberta's Premier has been clear. Protecting lives and livelihoods is the reason why a lockdown needs to be avoided at all costs. But at least one Calgary business owner says he's shutting down anyways. The owner of Dickens Pub shared this on Facebook Sunday. "We are going to close for 2 to 3 weeks. I care about my staff and my customers, and it feels wrong to keep inviting everybody down here with the case numbers spiking badly."
I feel like a tsunami siren is wailing.
The head of Calgary's Emergency Management Agency believes there is no time to waste, calling on the province to shut down all but essential businesses for 28 days.
It's my job. It's not popular. It's my job to tell people when I think that we've reached a tipping point. And that's where I feel we're at right now.
But on Sunday, Alberta's Premier continued to ask Albertans to do the right thing on their own.
These are relatively modest measures, and I really hope that people respond positively, because if not, we'll have no option but to look at more restrictive measures down the line.
Under Alberta's Public Health Act, only the provincial government has the authority to implement a lockdown. Public health officials can only offer advice.
If you publicly disagree with the government, you split the leadership right at the very moment that communities need clear leadership.
Dr. James Talbot was Alberta's chief medical officer of health between 2012 and 2015. He says when there is a disagreement with government, it's often best for public health officials to continue working quietly behind the scenes in the hopes of gaining allies and changing minds. But he also warns that after a successful spring and summer, the situation in Alberta has become very serious. And without action, ICUs in the province could be overrun in just a few weeks' time.
It's the last period and there's a surge happening, and we have to clamp down on defense, and we have to play every shift as if lives depended on it, because they did.
Heather, Yourex-West, Global News, Calgary.
Nunavut, which reported its first case 10 days ago, is ordering the closure of non-essential businesses for 2 weeks, beginning on Wednesday. In the last 24 hours, 6 new cases were confirmed in Arviat, where a COVID-19 outbreak has been declared, and officials are concerned about community transmission. 2 new cases have been reported in Rankin Inlet, bringing the territory's total case count to 26. Under the mandatory restrictions, schools moved to remote learning, childcare centres are closed to all but essential workers, and non-essential travel is strongly discouraged. In British Columbia, there were nearly 2,000 new cases reported over the past 3 days.
We are in the most challenging of times. We have come through a wave. We're now in the midst of our second. This virus is in our communities and can spread very easily. We need to say no to social gatherings right now. We also need to minimize our travel. We need to stay local, stay in our communities now, and take those measures which will help us bend our curve back down.
How to stop the spread without completely shutting down life is the challenge everywhere. Schools have mostly stayed open and transmission of COVID-19 within schools has been limited. But as the virus spreads through the community, that could change. Some provinces are weighing whether to start Christmas break earlier to reduce the risk. Robin Gill explains.
There have been 5 exposures at this elementary school in Surrey, BC since the new term began. Now it's finally closed because of an outbreak. The most serious COVID-19 case involves a music teacher who's in intensive care. Parents wonder why the school wasn't closed earlier.
She's the only music teacher, so for her to see kindergarten all the way up to grade 4 students in 1 week, that's breaking the cohorts. So why is it that she, as a teacher, is expected to see that many students?
2 other schools in the province are also closed. There are staffing shortages because teachers have had to self-isolate. Now there's talk of extending Christmas holidays to stop the spread.
We're obviously looking at other provinces that are considering an extension of the holidays at the other end, following on Christmas and New Year's activities.
BC schools make up less than 10% of the approximately 13,000 cases that have arisen since the start of the term. Here's what it looks like in other parts of the country. In Ontario, more than 3,300 students and staff have been diagnosed with COVID-19. It's 3 times that in Quebec, and that province is considering an earlier Christmas break.
Schools are a place of transmission. That is why we're evaluating the possibility of closing the schools for a limited period of time.
Ontario is holding off for now.
That's the last resort to shut down schools. I know the parents enjoy that the kids are going to school. The kids enjoy it.
But some infectious disease experts say schools don't need to go back into lockdown.
Absolutely not. I think that would be the last thing I would do. I continue to think of schools as probably the safest environment that we have. We know who goes in, we know who comes out.
Still, that's not reassuring for all parents.
It started in one class that had to isolate. It moved to 2 other classes.
This school is just one example of how the virus can move swiftly, less than 3 months after returning to the classrooms. Robin Gill, Global News, Surrey, BC.
Pushed to the brink. Coming up, the U.S. could see another 1 million COVID-19 cases this week, and doctors face having to ration health care. Plus, the looming disaster from a history-making hurricane. In the U.S., worst-case scenarios are becoming real life in some places. With cases accelerating fast and with no strategy from President Trump, mayors and governors are imposing new restrictions, but community spread is already so rampant in some cities, hospitals are overwhelmed, and doctors are being forced to decide who gets treatment and who does not. Jackson Prosco reports.
In El Paso, Texas, the grim job of transporting the dead has fallen to prisoners. They load bodies into refrigerated trailers. There aren't enough healthcare workers to do the job. In state after state, hospitals are at or near capacity. Doctors may soon face tough choices about who to treat.
Right now, the trajectory of increase in the number of cases per day is astronomical. It is extreme.
The record number of hospitalizations today is the result of infections from 2 weeks ago. 2 weeks from now, the situation could be apocalyptic.
We do know what's coming. We're seeing so many cases day over day that unless definitive steps are taken to interrupt the transmission cycle, exceeding capacity is a mathematical inevitability.
Restrictions are coming back fast. Chicago has moved to a stay-at-home advisory. Most of California faces sharp restrictions. Michigan has told high school and college students to stay home.
If we don't take aggressive action right now, we could soon see 1,000 deaths per week here in Michigan.
President Trump's top coronavirus advisor slammed the shutdowns, tweeting, "The only way this stops is if people rise up," while Trump has effectively given up on efforts to control the virus.
If we have to wait until January 20th to start that planning, it puts us behind over a month and a half.
For now, President-elect Joe Biden is helpless to do anything about it, having been blocked from starting a formal transition of power by Trump's refusal to concede. By the time Biden is inaugurated in late January, models suggest more than 360,000 Americans will have died. The arrival of a vaccine will not erase the staggering toll of the pandemic, growing worse with every day. Jackson Prosco, Global News, Washington.
Still ahead, the peculiar parrot that won a Battle of the Birds.
You're watching Global National.
Another fierce hurricane is bearing down on an already battered Central America. Hurricane Iota is now a Category 5, the strongest of the season. It rapidly gained strength in the past 48 hours, and with 260-kilometer-an-hour winds, damage could be catastrophic. Iota is forecast to make landfall in northern Nicaragua tonight. The region is still recovering from Hurricane Eta. That storm brought intense rain that triggered floods and landslides in 3 countries and killed up to 150 people. Iota is the 30th named storm to form in the Atlantic this year. That is unprecedented. The last time there was a Category 5 storm this late in the season was 1932. In New Zealand, a winner has emerged in a cutthroat Bird of the Year competition. It can't fly and it hides during the day, but the kakapo has been declared New Zealand's Bird of the Year. It's the world's heaviest parrot and it's the longest living. Those traits make it vulnerable. The kakapo was on the brink of extinction in the 1990s. Thanks to conservation efforts, there are now 213 of them. And just FYI, they apparently smell like the inside of a well-used clarinet case. And there are allegations of voter fraud in this contest. The polyamorous Hee was endorsed by an adult toy store, yes, and the little spotted kiwi received 1,500 votes cast one night from the same IP address. Even avian democracy is under threat, it seems. Up next, 38 years after war, the Falkland Islands are finally free of landmines. Every day, somewhere in the world, someone dies or loses a limb because they stepped on a landmine. The weapons of war are left behind to kill and maim civilians long after conflicts have ended. In the case of the Falkland Islands, it's been almost 40 years. Now, people there can finally, safely walk on the beaches again, thanks in part to a treaty signed here in Canada. Crystal Gamansing reports.
Digging in the sand and playing
This beach and all of the Falkland Islands are now landmine free.
Yeah, it's brilliant. This is the first time I've ever been on it in my life.
For nearly 40 years, landmines littered this region. A tactical and deadly weapon used by Argentina during the Falklands War with Britain in 1982. In 2009, clearing efforts began. Guy Moreau was there on day one and was on the beach when the last one was detonated in a special ceremony.
It was a very emotional day for people here. It was certainly, I found it really quite emotional. By the time I got to the end of my speech on the day, trying to control the lower lip.
More than 12,000 anti-personnel mines were physically collected.
This little anti-personnel mine is the most common mine in the Falkland Islands.
Britain was obligated to clear the mines from its land under the Ottawa Treaty. More than 160 countries have signed the treaty agreeing to ban the use, production, and sale of landmines. Lloyd Axworthy helped launch the Ottawa Treaty process and says more work is still needed.
The bad news is that some of it's coming back and they're still being used in some very crucial conflict areas around the world.
According to the international campaign to ban landmines, more than 60 countries and regions around the world are contaminated by landmines, with thousands of people living with the deadly threat every day. Princess Diana famously drew attention to the plight by walking in a minefield in Angola in 1997, and her son sent a message to the people of Falklands.
You are taking another step towards defining yourselves as the modern, community-spirited place that you have built.
A spirited and now safe place for future generations. Crystal Gamansing, Global News, London. And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is Winnipeg. We'd love to see Your Canada. Please send it to viewers at globalnational.com. Thanks for watching. I'll see you back here tomorrow. Take care of yourselves. Bye-bye.